A beautiful afternoon to you and many thanks for joining us on Healthy Living. Our sincere apologies for bringing the program behind schedule. And I'm here sincerely, Oluije Oikokai. Now today on Healthy Living, we'll be looking at unique clinical presentation and care of Lassa fever patients. Now on how to identify and differentiate Lassa fever from malaria, typhoid, and other common infections. Now remember that on Thursday was World Malaria Day, so our doctor will be doing justice to that, explaining to us the different symptoms we have as regards Lassa fever. Now he goes by the name Dr. Joseph Okwegale. He is the director, Institute of Viral and Emergent Pregnancy Control and Research, IRA Specialist Teaching Hospital. Good afternoon, Dr. Joshua.
Good afternoon. I'm happy to be here.
Okay, so how is IRA this afternoon?
We are fine. Traveled for a conference in Abuja.
Okay.
IRA is fine.
All right. Okay, now quickly let's go straight into the topic of today, Lassa fever. Now quickly, what is Lassa fever?
Okay, I hope you can hear me clearly.
Yes, very well, very well.
To be sure. Okay.
Very well.
Lassa fever is a fairly severe viral hemorrhagic. It is common in many West African countries. If I say West African countries, I mean Nigeria, common in life. It has been estimated the 14 West African countries, over 37.7 million people developing this disease, developing the Lassa virus disease. Of course, yearly, it accounts for 100,000 cases in West African countries, cause over 5,000 deaths every year. The burden is quite high in West African countries. But let me mention that apart from these West African countries, cases have also been reported in many other nations. There have been reports of some imported cases of this Lassa virus disease in the Kingdom, in Germany. Some cases have been reported. So yes, although it's common in West African sub-regions, we reported inside the West Africa sub-region.
All right, so how can one know if a person has Lassa fever? Now, what are the symptoms?
That the Lassa virus disease is caused by mainly there's a sick of rat which is called the Mastomys thalensis. Is a species rat. Not every rat will cause the disease. Of course, it's a very unique kind of rat. It's copiously, multiply breasted, and of course, it's peridomestic. Survive both in our homes and in bushes, so it can be anywhere. When it happens like that and it affects the foodstuff that we consume, could lead to the Lassa disease. Of transmission can be from the rodents. Rodents actually rats to human, human to human. Human to human transmission occur mainly a hospital setting, usually for very vulnerable populations like the healthcare workers who have contact of these patients who have been infected by the disease. They could also get infected, but mainly rats to human. How does rat cause this disease? In most cases, when some of the rats, dive into, our homes, some of this food which we dry along the roadside, like grains, dry gari along the roadside, they dry granite along the roadside, and when the rat come into such, foods that are dried, defecating on them or urinating on them, it could consumed, it could lead to the development of this illness.
Okay.
From this, apart from this, when you have the rats in our homes and you have foodstuff opened down, it's opened down, curry is opened down, our granite is opened down, and they consume it when this rodent gets in contact with some of these things to the illness.
Okay.
With people who have had fever, febrile, or they've been managed for a known illness and they don't know, contact the disease.
Okay.
Care worker managing a patient without taking necessary precaution in the hospital, particularly, for cases that fever could get infected. Common mode of presentation. What are the common ways with which they could come, present to you in the hospital? Commonest way they could is by fever, having high body temperature, running temperature.
Okay.
Sometimes, because other common febrile illness could come in like this, somebody having fever, having headache, having malaria, becoming very weak. Fever can cause extreme fatigue, very weak. Eating, having red eyes, it usually presents like that. And it's sometimes very difficult to now differentiate it. Illness like malaria. Some will confuse it with typhoid. So what we usually advocate is that if you start treating illness, because people patronize over-the-counter medications very well.
Yes.
Go to chemist, to the pharmacy to buy medications without having to do the appropriate
the tests
thing they need to do. So when you treat, you're taking anti-malaria, it doesn't work. You are taking typhoid medication, it doesn't work. You don't need to continue.
Okay.
To now come to the hospital to get proper testing done, because that's the only thing that could differentiate, be able to tell you what you're actually having. But unfortunately, the test for Lassa virus disease is free. Specialty Teaching Hospital is a reference center for diagnosis, control, management, and research. Major and emerging infectious disease, particularly Lassa fever. Because when samples come in, turnaround time is within 24 hours, and you get your result. We do. We are also collaborating with the University of Benin and a couple of other institutions in Edo State to see that they don't suffer in trying to get where to get tested for Lassa virus disease, which is fine. I mentioned that yes, it's difficult in some situations to actually say, yes, clinically this is Lassa and this is not Lassa. But there are unique things you may see in a patient and say, yes, it could be Lassa.
Okay.
And gives a history that he or she had been exposed to someone who was ill. Subsequently, he or she became ill. It's an indication to test for that and say,
okay, all right.
That is not Lassa that person is having.
Okay. All right. Now, most times we know that on Thursday was World Malaria Day. Now, we find most persons going over the counter to say, okay, I have a particular symptom. I just know it's malaria. So just give me some medication. So what are the unique signs we should be able to know to differentiate between or from malaria to that of Lassa fever?
We're talking about some of the symptoms of
yes, how to differentiate. Yes,
I'm happy that we just celebrated the World Malaria Day, which is key. That is endemic in Nigeria and many other developing parts of the world. It's also an opportunity to remind our people that yes, all this think is malaria may not actually be malaria. Further infectious morbidity that could also present with malaria. The commonest symptom of malaria is fever. Becomes hot.
Yeah.
But we see. I'm not sure every normal person in Nigeria would have treated for malaria at one point in their life. Or there's anyone who has actually not had malaria. Can tell you in some categories of that becomes more severe and can even cause death. Children who are less than 5 years, the risk of even dying from malaria can be very high. It could have cerebral malaria. They could have complications, hypoglycemia, a couple of complications from malaria. They could die easily from malaria. Could cause maternal and fetal morbidity and mortality in pregnant women can become very severe area. So, time to identify this and do proper diagnosis. It's difficult. People in Nigeria are particularly poor. Malaria testing done in Nigeria can be difficult. Microscopy for malaria may just be over 2,000 naira in regular hospitals. Some rapid diagnostic tests might be cheaper. Nigeria may never have 500 naira to go into the hospital test. So they would rather prefer to use that money to go pharmacy to get common anti-malaria to take.
Okay.
Themselves tested first or being treated.
Okay. All right, sir.
Down to economic downturn, issue of poverty, and you understand the issues. Malaria is also commoner in environments with very poor hygiene. In rural environments, people who live in very thatched houses, environmental conditions, which in poverty-stricken population.
Especially, yes, especially with the fact that we are having the rainy seasons coming in.
Going to have. As in, over-the-counter medication, chemist, pharmacy, without having to make proper diagnosis of what is wrong. So I'm happy that, again, celebrated the World Malaria Day, and happening to remind everyone that yes, it's malaria. We know we have malaria. We know malaria is endemic. Let us also try to find out, yes, malaria and it's not going, persisting is an opportunity. But again, I say yes. Let me try and see whether there's a possibility.
All right. Okay.
Pathogen causing this illness which I'm having.
Okay.
And it's important to know that for a disease like Lassa fever, there are certain times in the year when it's commoner, particularly the dry season.
Okay.
Tell you the dry season we usually have sorts of cases. At some point during the last outbreak, we had over 2 cases admitted at the same time in the ward.
Okay.
We'll be very busy with high number of cases such that the ward may not be enough to contain the number of patients that will come down with Lassa fever, with a couple of mortality.
All right, Doctor.
Develop the Lassa virus that eventually come up with symptoms.
All right. Okay, now this.
Anything. So those ones are just left in the population.
All right. Okay, now, Dr. Joshua, can you hear me? Dr. Joshua.
We come up with severe symptoms of the disease.
Okay. All right, so Dr. Joshua, thank you so much for being with us today, despite the short notice. Thank you so much. We'll look forward to more time to discuss this more elaborately, talking about Lassa fever. All right, this is much you can take today on Healthy Living. To have yourself a blessed day. Remember, health is wealth. Bye for now.